Today, a look inside See, Test, and Treat, the CAP Foundation's signature program.
When you tell the patients directly that she can go home and she can sleep and that she is fine, she does not have a breast cancer that she has been worried for 10 or 15 years. Looking at her gratitude, looking at her eyes is priceless.
This is Path News Network, Daily Edition from the College of American Pathologists. I'm Nick Lonnie with a special edition of the podcast. It's Tuesday, July 21st. Since 2011, the CAP Foundation's See, Test, and Treat program has provided free breast and cervical cancer screenings as well as follow-up care to more than 8,500 women in 18 states across the U.S. The vast majority were underinsured or uninsured. The program is funded through tax-deductible donations to the foundation and led by pathologists at their home hospitals and clinics. Here's how it works. Pathologists apply for funding to host a See, Test, and Treat day at their hospital or institution. New applicants can receive up to $20,000 to support specified expenses. Repeat applicants can expect a decrease in funding up to 10% from the previous year. The goal is to gradually encourage the programs to become self-sustaining. The local programs invite members of the community to make appointments for screenings on a single day, at which pathologists, other providers, and volunteers greet them and guide them through the process. It's usually a festive atmosphere with refreshments, informational booths, and Ask the Pathologist sessions. Test results are delivered by pathologists, and follow-up resources in the community are made available. Dr. Jeremy Hart is Assistant Vice President of Laboratory Services and Medical Director for Laboratories at St. Elizabeth Healthcare in Northern Kentucky. He painted a picture of how the event goes there.
It's always a very early start of the day, and so we have volunteers who are arriving prior to 7 a.m. Even though we don't schedule our first patients until 8 a.m., we have found that many of the participants will arrive early, and so we're prepared for them. We actually have had, each year that we've hosted, we've probably had between 100 and 150 volunteers. Many of those individuals are bilingual speakers, and so we use those volunteers for patient navigation. We have some specially medically trained interpreters who also assist on the day of the event. And I will tell you that the vibe for the event is warm, it's energetic. If you think about it, with the 100 to 150 volunteers, you've got a ratio of volunteer to participant of 2 or 3 to 1.
Dr. Julieta Lastra is a gynecological pathologist and associate professor at the University of Chicago Medical School, and she chairs the CAP Foundation's See, Test, and Treat Committee. Dr. Lastra explains that while testing is at the heart of the program, it's not the only goal.
Our programs are not only designed for the screening of cancer or other diseases, but also for connecting with care. So we make sure that if there is an abnormal result, that something happens. These patients get connected irrespective of their ability to pay, irrespective of other barriers, language, social, cultural, etc. We make sure patients get connected to care. And I think last but not least, it's also the educational component of See, Test, and Treat, right? Patients report, when we have done surveys on site, a significantly higher level of trust in healthcare, significantly higher level of trust in their care providers. Many individuals in our communities, many of our patients, for the first time, get to know what a pathologist is. Who is a pathologist? And this is how they learn about it.
Dr. Ava Wojcik, Chair of Pathology and Laboratory Medicine at Loyola University Medical Center in Chicago, has hosted See, Test, and Treat at Loyola for more than a decade.
I'm not exaggerating. Truly changed my personal life, but definitely the life of our department and the way how we are being recognized by rest of our institution. We have proven that we pathologists can be leaders of the entire medical team, because to offer this program each and every member of the healthcare team, starting from the security officers to the department chairs and presidents, are being involved. And it's really elevated our department within our institution.
See Test and Treat's original model was to focus on breast cancer and have everything happen on the same day: testing, results, and the recommended follow-up care. Cervical cancer screenings were added later, and this year more flexibility was added to also include colon and lung cancer screening, as well as diabetes, hypertension, and STD screenings. Dr. Lastra told us why.
In listening to comments from our grantees, in listening to the experiences on the trenches, as I said, on the ground, and in getting more information about the needs of our underserved communities, we came to realize that there was a number of other potential screenings that should be happening and that we could offer.
The foundation also allowed more flexibility in the timing of test results, because some locations couldn't accommodate the same-day turnaround. Dr. Hart explained how the change helped the St. Elizabeth's program.
This year, we are partnering with a local community organization. It's called Faith Community Health Network, and their mission is to provide comprehensive care to members of the community who have no insurance. And so they're fulfilling an extremely important niche in our community. And so by moving the event from our health system's cancer center to a community location, it's going to be logistically a little bit more challenging to get same-day test results because of the specimen transit to our main lab. And so having this extra flexibility allows us to move the program into the community, closer to patients, in partnership with an organization that's going to be connecting them to, long-term sources of care.
All three of the doctors strongly encourage all pathologists to support the program, either as a host or as a financial supporter. As Dr. Lastra said,
who wouldn't be satisfied by being able to provide care in your community, right? It's a fulfilling thing to do.
That's all for today. See the show notes for more information. Feel free to share this special edition on social media and spread the word about See, Test, and Treat. We'll be back Wednesday at 5 a.m. Eastern for another episode of the Daily Edition. I'm Nick Lonnie. Have a wonderful day.